I'm Stella Whitney-West, and I am the CEO of NorthPoint Health and Wellness Center. We start off with our mission, and our mission is partnering to create a healthier community, and certainly our partnership is with the community, with our staff. So NorthPoint has been around 55 years, and we are a community, not only community-led, but we actually were born out of the community. We actually came about, there was a rebellion on Plymouth Avenue in 1967. And the community wanted to have services in their community. And so they wanted to have health care, they wanted to have access to education, housing, employment, and they wanted it in their community. So there was a group and that came together. It was called the Tactics, and it included not only people from the community, but also people from the county, from the city, and they came up with this plan. And the plan was really pilot city, where all services would be integrated under one roof, right? And as we have grown and expanded on the services, the actual plan and model has really stayed the same. And the community has responded by continually to come and support. So we are a community legacy. We have generations of families who have been served here, and they're very proud of that. And we love hearing the stories from the community of how their family has been taken care of by Pilot City NorthPoint. We talk about that we have 3 pillars. So one is whole person integrated care, which means that we see people as the whole person. People are connected to a family, they're connected to a community, they're connected to a culture, they have a history. So when they come into NorthPoint, whatever the service is, we as a staff, number one, we treat them as guests, but we see them as a whole person, and they can show up as their whole person, as to who they are. We think that's critical.
My name is Xiong, and I am an OB nurse at NorthPoint Health and Wellness Center. The work that I do in general, especially with our OB population, is that we have a care coordination department, and we work with these women who come in for care, and we work with them to the point where not just for their self, but also with their unborn baby and their extended family. And if they have issues or concerns, we work with them to break down those barriers. So for example, these care coordinators will work with them if they have issues with transportation, if they need to get to their appointments. We have services that will help them to get to their medical appointments. If they need services downtown, we can have the transportation through our vouchers to help them with that. If they have like a child who comes here to NorthPoint and they need to get here, we also provide them help and services. We also schedule the appointments for them so they don't have to worry about waiting for long appointment calls to get in. So we work not just with them, but also with the whole family, so that's one less barrier for that mom, and that's one thing that's very special. On top of that too is that we have care coordinators who are bilingual, and that's one thing too that's very helpful and supportive. It's that they're working with people who look like them, and that they understand the cultural aspect of where they're coming from and the daily life that they work with and what they are facing, so that when you work with somebody like that, it's very special and meaningful. Like for example, for our Hmong patients, they know that we come from the same background, and they know the life struggles and what we go through. And when we make these appointments, they know that family is very important. And how do we work around with them and get them the medical services that they need, but at the same time deal with what else is going on at home as a whole. And so we as care coordinators is very unique because no one has that. that I've seen, that NorthPoint is unique in that. We also work with a lot of resources here in ourselves because we have many departments here at NorthPoint. NorthPoint historically is a one-stop shop. We know that historically a lot of families struggle because they have to go to different places to get a lot of things that they need. And the reason why NorthPoint is centralized in North Minneapolis is because we want to be that one-stop place where families could come here to get all the services in one place. So we have behavioral health, we have dental, we have medical, we have the WIC program here, for women who have small children. We have classes, the doula program, all the stuff that we actually service for women and children and extended family. It's all here. And that is the history of North Minneapolis. It's the history of NorthPoint.
The other is community well-being, because it is so important that the community as a whole is a healthy community, and all of the aspects of a community that make it healthy has a major impact on the community members that live there. So we are focused on community well-being. So we do a lot of events and a lot of outreach that is in the community, and it's open to the whole community because the community has to be healthy, right? So that the guests and individuals that receive services here at NorthPoint can live in a healthy community.
My name is Peggy Moore, and I am the Community Health Worker Program Coordinator for NorthPoint. NorthPoint is so diverse, and we are in the community. We're doing all kinds of outreaches in the community to educate and to make sure that we have events and include the community. Having different resources and different programs, not just medical, but we have human services for food, for housing, support groups for all different ages, mothers that are expecting. So NorthPoint is always getting the word out, whether it's radio, whether it's just in the community at outreaches. We connect with partners and we make sure that we're engaged. So we make sure that they understand that we have all kinds of resources for them. So, and NorthPoint does that. We're not just in the buildings, we're out in the community. Proudly, I am a patient at NorthPoint, have been for years. My provider is here, and I'm so grateful for him. And so it's convenient for me. And as I deal with my participants, my seniors, who I come engage with, when I talk about being a patient, I can talk from that angle so they understand that I'm just not speaking something. This is what I live, and I'm okay with it. And I think NorthPoint has so many great providers at different levels. And so I let them know they can feel safe and that it's confidential, and to feel free to come and make sure that they establish care if that's something they choose to do.
The third pillar is health equity. We believe that everyone deserves health care. They deserve access to services that is equitable, and that everyone should be able to receive what they need when they need it, and that it is fair and equitable.
My name is Samuel Alcocer, and I'm the supervisor for the Interpreter Services and Transportation, a position that has shaped my life, the professional and personal. Now it's almost close to the 40% of patients who come into NorthPoint, they are in the need of interpreter services. When I started working here, it was 2%, 3%. But the integration of the Glenwood, Lindale, and Pilot City create this opportunity to grow in our language services and cultures. And the interpreters, as I mentioned before, they just help to break the barrier of the language and communicate with providers who they come here to NorthPoint and seek the services on a regular basis. Our interpretive department works through the entire campus. It works for the medical department, for the dental and behavioral health, lab, radiology, finance, pharmacy. Every department, every patient will need to be touched, every department and every service that we have here. And not only that, the beautiful thing about NorthPoint is that we also have the human services piece. So when they're coming over, they also need to have some of those services through the our NorthPoint Inc., who is offer it. And interpreters go to every corner of our campus. The healthcare system is complicated. It's complicated for anybody who actually do speak the language. And you try to understand the parcel and the billing area, or try to understand what type of coverage you actually have and for the medical insurance. And you constantly be on the phone, try to figure it out. You're actually able to go to one place or another, and when everything comes to you and one huge bill, you try to understand like what happened. I only went for a ear checkup, and what is all of this about? So understanding that part for our patients is very important, and I think is the communication. The interpreters help to navigate the healthcare system is very important. My journey at NorthPoint started in the spring of 1996. As a young fellow, I came looking for services to the clinic. Little did I knew that was going to be my passion later on in life. At that time, I did not speak a word of English, and when I looking for the services in the clinic, there was no one there that were able to help me. So I left with the same tooth pain that I walk in. Years later, in 2003, an opportunity arose, and it was a pilot project. Pilot project is supposed to be last 6 months, and I took the opportunity. It was the call for me to come back and finally be the voice, not just for myself, but for others who were in the same situation as me, to be heard. So 20 years later, here we are. It's been an incredible journey over the years, and I'm very, very happy to be working in this organization.
The Stronger Together campaign is really the community campaign. In our Stronger Together campaign, there are really 6 areas that we are focused on in terms of funding with this campaign. Our dental specialty services, we have an outstanding dental clinic, and one of the areas that we want to grow is the pediatrics, and also to have services for those who have mobility issues. Our food shelf distribution, continually to provide the excellent, creative, innovative ways that we are able to have access to food. Our bistro, cafe, and then our teaching kitchen. We know that food is medicine, and we know that making sure that our families have access to healthy foods and know how to prepare those healthy foods require that we have a space. So the teaching kitchen is extremely important for that. And then the drop-in child care wellness center, so that, again, families, parents can come, make sure that they are able to have their appointments as well as appointments for their children without having to be worried about child care. They know that they can bring their children here. And then health equity programming, we have models of, I call them our cultural care models, where we have really developed models that work with the different cultures that we serve here. Our Hmong culture, our African American culture, and our Latino culture, our LGBTQI culture as well. We know these models work. What's important is that we have a space, so we do in our conference center, where we can then provide the training and access to others providers so that they know that these models work and we want other people to be able to use them. So that's important. And then having a place for spiritual healing and wellness. I mean, a person's spirituality is connected to their healing and their health. And there needs to be a space where people can make that connection, not only for our guests and our patients, but for our staff as well.